Hi, everybody, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Adam Chaifetz, who will be talking to us today about chiropractic care and the management of MS. After a presentation from Dr. Chaifetz, we'll open it up to your questions and comments. Now I'm delighted to introduce our speaker. Dr. Chaifetz is a board-certified chiropractic neurologist. Since 2008, he has been the program coordinator for the Comprehensive Multiple Sclerosis Center in the Department of Neurology at the Jacksonville campus of the University of Florida. He manages the program through the interaction with patients, providers, and auxiliary staff personnel. He is also a strong advocate for patients and interacts with governmental relations representatives and local federal legislature. Dr. Chaifetz has been in clinical practice since 1987. His expertise has always been in a collaborative medical environment. Dr. Chaifetz has run and managed the largest chiropractic practices in Jacksonville, the first chiropractic rehabilitation center director in Jacksonville. He has always been at the epicenter of collaborative care with his patients. Utilizing medical physicians in practice, his patients have always benefited from a thorough and comprehensive approach to healthcare. We're very pleased to have him join us today to present this wonderful topic. Dr. Chaifetz, we're so happy to have you here. I'm going to turn it over to you.
Great. Good afternoon, everybody. Thank you so much, Deborah and Casey, for allowing me to present a subject that I think I have a little bit of knowledge on. Most of the time when I do present, I'm talking about pretty standard things that go on in MS care, but I thought today that I would talk a little bit about chiropractic from the standpoint of somebody who has been in practice long enough to see patients that have never been on therapy before there were even therapies out there. So I'm going to share a little bit of my experience with you in terms of what I know, both as a chiropractic doctor and also as a person who is very much embedded in the MS world. And my goal is to give you the ultimate knowledge to know whether chiropractic care would even be a good fit for your specific MS condition. And I have treated MS patients since 1989. And so when I did start treating patients, I had to learn very quickly about MS because one of my first patients that I saw was in a car accident. And actually, her symptoms had resolved and she still had some symptoms that were remaining. And we basically sent her for an MRI and we were able to diagnose her with MS, which seemed like a pretty interesting thing at the time. The only thing is there were no treatments available. So when I contacted her family doctor said, well, that doesn't matter because there's nothing we can do for her. So that was my first experience in dealing with a multiple sclerosis patient who I think probably had a progressive course and was starting to develop not only problems from the car accident that she was in, but also issues from a progression from a multiple sclerosis standpoint. So I'm going to dive right into my presentation. So when some of us chiropractors see MS patients, some of us may see them even prior to their diagnosis. And it's not uncommon that some of my colleagues have told me, and I've even been contacted by my colleagues over the years, about patients that they've had that have had symptoms. And after treatment of a reasonable amount of time, their symptoms didn't go away. So some of the symptoms that we see in patients that enter a chiropractic office that could end up going on to an MS diagnosis are things like numbness and tingling in the extremities, tightness or muscle spasticity, muscle weakness, and neck and back pain. So we see this a lot, definitely in patients who are diagnosed with multiple sclerosis. But unbelievably, these are some of the things that bring a person into a chiropractic office. And we've managed several patients that were totally and thoroughly asymptomatic, got in a car accident, developed headaches after the car accident, had a brain MRI by a neurologist, and they were diagnosed with MS. So it's not uncommon sometimes that a trauma or an incident brings out a diagnosis of MS when it isn't even symptomatic. Now, is that isn't a majority of cases by any means. So patients who have these symptoms prior to the diagnosis, of MS, if they see a chiropractic doctor for what may be perceived as a pinched nerve, now understand these people could also see their family doctor. And not all family doctors are going to be prone to, let's do $1 million workup and MRIs. A lot of times patients are sent to physical therapy, they're given meds. If it doesn't resolve, then they go further, okay? And all the MS patients know that over the pattern of their condition, if they have a relapsing form, that their symptoms can come and go, especially aggravating symptoms like numbness or tingling, things like that. So patients who go to chiropractic offices without a definitive diagnosis, they could be treated as if they had a simple neurological problem. But what's the difference between a patient who's treated simply for a pinched nerve versus one who's recognized as having diagnosis? And that answer is always in the provider who is treating the patient. So an astute family doctor, just like an astute chiropractor, would be able to see certain signs in the examination of the patient, because believe it or not, the same exam that I do is the same exam that the neurologists I work with do. It's a complete neurologic exam, which includes a lot of central nervous system tests. And that tells us as neurology professionals that we're dealing with a central nervous system problem instead of a simple spinal problem. So those of you that have MS know that in order to be diagnosed with MS, they don't just look at you and say, okay, you're this age, you're this and that. There have to be several criteria that have to be met in order for diagnosis to be done. So those criteria include episodes or relapses, usually at different times in different areas of the central nervous system. So MRI scans are, absolutely necessary in order for us to see what the person's brain and spinal cord looks like, to see if we're dealing with something like multiple sclerosis or a number of different conditions that can mimic MS. So even trained physicians can miss or misdiagnose MS if they don't perform a detailed workup and neurological evaluation. And I would say that many family providers do not do a detailed neurological exam. So when we look at the MRI, familiarly, if we look at this image, the image on the left is what we call an axial view. It is where if you were to cut the top of the skull off and look straight down, what you're seeing are multiple round spots in the deep white matter or the cortex of the brain. The MRI next to it is what we call a sagittal view, and it shows a number of different white spots or lesions in the areas that are very, very, very common which are the ventricle areas of the brain. Now, my next picture here, the reason I picked this is a very important picture for you all to see because there's actually a couple things going on here. Now, one of the things that our radiologists do not have the benefit of, and that is a nice big red arrow pointing out where the lesion is. So just put on your radiologist hat here and take the arrow away and say to yourself, do you recognize something in the spinal cord here? And if you do, then what you are looking at, this is a spinal cord lesion in an MS patient, but it is a very sizable spinal cord lesion. As a matter of fact, it occupies probably a majority of the content of the cord. So what does that mean? It means that signals that are going up to the brain, sensory information which goes to the brain, can be interrupted, just like motor information going down from the brain that supplies all the muscles and your organs and what have you. Now, if you also look to the left of the arrow, the person also has a neck issue. So I can't tell how much or how old this person is, but they're not that old. I would say they're probably in their 30s or 40s. And if you look at where the cord lesion is, the disc level above it, the person has a degenerated disc and actually has spurs on the vertebrae in front of the vertebrae. So the reason I'm bringing this out is this person can have MS symptoms, but they're also most likely going to have a stiff neck too. And so I just wanted to demonstrate to you that not everything is going to be MS related. The neurological symptoms absolutely are going to be neck related. But if you can't turn your head to the left when you wake up in the morning, that's probably not an MS problem. So that might be something that we would see when we do an X-ray in a chiropractic office, because X-rays are not like MRI. They don't image the central nervous system. Now these images here, this is another axial view on the left of a brain. You're looking down at the brain, and if you look in the inside, you'll see what looks like a butterfly pattern. They're white. Those are the ventricles of the brain, where fluid flows through the brain. And if you look laterally to those ventricles, again, you'll see the circular ovoid type lesions in the white matter in the cortex. And then lastly, on the right, again, we're looking at the benefit of having the arrows pointing out where the lesions are. These are the optic nerves, and these show enhancement of both the optic nerve, and then where the yellow arrow is, it also shows enhancement of the cerebral cortex at the same time that the optic nerve has enhancement. So that looks or helps solidify a person's diagnosis when you see these findings. So as a person with MS, should you see a chiropractor? Well, it depends. I mean, if you're looking for a definitive diagnosis, meaning you've been to other doctors, nobody can steer you in the right direction, we might be able to help by trying to get at least your history and maybe some imaging so that we'll know whether you meet the criteria. But more thorough evaluation is usually needed, and that could include things like a lumbar puncture and an entire series of blood work to rule out a bunch of different diseases which are mimickers for MS. So in a chiropractic office, while we don't usually render the diagnosis, in many cases we might assist and actually be sending the patient to the neurologist who does eventually diagnose them. So again, a competent chiropractic doctor can assist the patient in a referral to a neurologist and for additional procedures. What if you already have MS and you've been definitively diagnosed? I see patients that have MS, and these are the main reasons: for muscle spasticity, for neck or back pain, and usually the spasticity can play a role in causing or creating the neck or back pain that a patient has. So many patients that have MS, they have spasticity in their legs, but they can also have spinal spasticity and spasticity in the muscles of the spine. Here I'm examining a volunteer model, and this patient here, as you can see, has an AFO on his right leg, and he has quite a bit of spasticity in the lower extremity. So when you go to your neurologist, hopefully they are checking your spasticity in your legs by doing a straight leg raise, holding your muscles and just checking to see the tightness and the level of mobility and the easeability that you can move. Because as you know, spasticity can hamper the way you move, the way you walk, the integrity of your gait. So this gives me an idea of some areas that I may want to work on. If a person is having gait issues, they have to compensate for some of the motor weakness that they have in the lower extremity. One of the therapies that I use is called myofascial release. And myofascial release, I'll explain a little bit further on, is a type of bodywork therapy. It's considered to be an advanced muscle work therapy that was actually developed by a doctor who was President Kennedy's doctor. And what she did is she treated President Kennedy with injections into the fascia or the myofascia in his lower back because he suffered from very, very severe back pain. And her name was Dr. Janet Travell. So she is the one who developed literally the whole theory of trigger points. And what myofascial release therapy is it's a very safe, soft tissue-based therapy that is extremely helpful in neuromuscular conditions and also in conditions where spasticity may play a role in creating spinal pain like neck pain, low back pain, and especially compensatory pain from having mobility issues. All right, so here's a maneuver that I use to stretch the lower back. Now, when people think of going to a chiropractic doctor, they think of being possibly twisted in all different directions. However, there are many techniques that can be used that are very gentle, that are manual-based techniques, which merely are done to take pressure off of the spine by using directional force along with muscular therapy. So it can be very effective if a person has back spasm in their glute muscles, their hamstring muscles, all the way down their leg. So do all chiropractors practice the same? And the answer to that is definitely not. not all chiropractors like myself do all of their own hands-on work. There are many doctors who employ massage therapists. Some of us have physical therapists that work with us. I taught hundreds of massage therapists, occupational therapists, physical therapists. I taught in the massage field for over 10 years. So over the years, I've trained hundreds of therapists. So a person can have a variable background in receiving myofascial release therapy. And so it's not uncommon to see chiropractic offices that therapists are employed in. I'm going to also talk about a couple of the other therapies that we utilize, not only in general practice, but for patients that have MS. Electric muscle stim is the utilization of electrical current into the muscles to stimulate the muscle, which causes the muscles to contract and then eventually to fatigue. When you think about tight muscles or muscles that are in spasm, think about the contraction of the muscle being extremely tight. And for a muscle, what that means is that when a muscle tightens, it actually shortens. So when you use muscle stimulation, what it can do is it can cause the muscle to fatigue and help decrease both the spasticity as well as the paravertebral spinal spasm that may be happening because you also have a neck condition too. And what muscle stim does is on a patient that has chronic spasticity, if you use muscle stim with some moist heat, if you can tolerate heat, it'll help to facilitate passive stretching, which is also a mechanism that will help relieve pain by decreasing muscle tension and increasing mobility. So neuromuscular massage is a specialized type of muscle therapy. Neuromuscular therapists, or deep tissue therapy as it's called, or trigger point therapy as some practitioners call it. This is an advanced massage technique that generally is done with people that have a little bit more knowledge than going to a chain massage establishment. So neuromuscular massage therapists, many of them work in professional offices like chiropractic offices, physical therapy offices. And these folks are going to be a little bit more trained to deal with conditions where advanced massage techniques are needed. Now, with MS, I would not recommend having significantly deep tissue massage done. And the reason is because you may get a rebound effect, which means that the deeper that the therapist applies pressure, the muscles may react and go into hypercontraction. So what I always tell my patients is that they want to be able to tolerate massage to the point where it's comfortable. If it's uncomfortable, that is not a point of tolerability. Now, there are cases where I have to get in there and dig with an instrument and release what are called trigger points, which are very, very, very tight, sensitive knots in the muscle. So if everybody grabs their neck and their upper back and they apply pressure right in here, they'll be able to feel literally little golf balls in their trapped muscles. Those are what we call trigger points. Now for passive stretching means stretching that you cannot do on your own. So let's say a person is chair bound, or like me, I'm chair bound all day because I sit in a dumb chair. And so the posture that you assume when you're sitting all day, whether you're chair bound or whether your mobility is just not good and you just choose to sit, your muscles are going to contract to the position that you adhere to most of the time. So if you look at the image on here, this is an example of a therapist, a chiropractor, whoever, doing passive stretching to a person's thigh. And I can tell you that more people than not who have MS or don't have MS have tight quadricep muscles. So there isn't anybody I know that couldn't get on their back on a table or a bed and be stretched like this and wouldn't benefit from it, because let's face it, most of us are sitting more than we're up and about. Chiropractor's tool is the adjustment. And so we utilize manipulation techniques that are referred to as adjustments. Now, these adjustments or manipulations, what they do is they help to restore the mobility to the joint in the spine and in other orthopedic joints. So many times relieving pressure in the back and the neck and the lower back areas. However, I've had many professional athletes as patients, golfers, professional football players, musicians, professional musicians. And many of these people have other issues too, like shoulder, hand, joint, what have you. So like physical therapists, chiropractors, we learn and study all the joints, not only of the skeleton and the nervous system, but we also study all the joints in the body. So we're able to look at different areas that can also help in addition to the spine. So all chiropractors are not the same. We do have a basic standard amount of schooling. However, like medicine, some people have interest in neurology, like myself. Other folks, their interest could be in sports medicine, orthopedics, radiology. We have radiologists. And then there are many in my profession that are involved in nutrition. So those of you who have been to a chiropractic office or are looking to go to a chiropractic office, please understand that many of us do specialize in nutrition, and many will try to do an analysis of your diet and see if a nutrition plan or a nutrition anything is going to work for you. Now, in my practice, I don't usually deal with nutrition on a level that I would consider to be a consultant. So I would refer to somebody who has more expertise in that area, just like my specialty is in neurology, and many of my colleagues pick my brain, for cases in my field that I'm knowledgeable about. And only a small percentage of us in chiropractic actually go on to become certified as specialists. And the reason is because many of us practice on our own. And so unlike in an academic setting, usually the more credentials you have, you end up building on that in an academic setting. But to be honest with you, there are even a lot of medical physicians that don't know that chiropractors specialize. And so to give you an idea of how prevalent chiropractic is in the world out there, almost every one of your professional teams, like all your NFL teams, many of your professional teams have doctors of chiropractic as medical providers, along with orthopedic surgeons and physical therapists and neurologists. So it is mainstream for many people. It is used very much in the field of athletics and rehabilitation to keep people functional. I think in my intro that Debbie was so gracious in her introduction. I was the first rehab director in the first rehab center in a chiropractic center 30 years ago. And I'm glad to see that rehab has really advanced to the degree that it has. And telemedicine is wonderful. But unfortunately, chiropractic fills the void of care that needs to be rendered on a hands-on basis. So chiropractic care is not something that we can do through a telemedicine format. It's like massage therapy. It's like physical therapy. It's a hands-on specialty that a patient has to engage in. And thank God, we are getting closer and closer to getting back to normal. So how does a person choose a chiropractor? Well, it can be challenging, but my best advice is the same way you would choose any other healthcare provider, and through asking either your doctors, your friends, your coworkers, your family members. You definitely don't want to choose somebody based on an advertisement or through some kind of pitch. So the red flag rule is, if you see a red flag, you should have your antenna up. So you don't want to choose a provider of any type that's going to give you an unrealistic cure, or one of those cures that nobody knows about, that's not readily available, but it will cure everything. So that's not the kind of provider that you want to steer towards. So chiropractic is one of those healthcare professions that patients can seek while they're being treated for their MS, but it's not going to cure their MS. So like physical therapy, it's something that I think will help a patient either in an ongoing basis or through periodic basis. Either way, I do feel there is benefit and value for patients who want to give it a try. And of course, you never want to discontinue your medicines at any time without the direction of your neurologist. Had a patient, was it last year? Very aggressive multiple sclerosis. Went to a lecture or read an article, and she stopped taking her infusion medicine. And the last time that I saw this young lady, she was in our hospital, and I mentioned to her that, it could be possible that if she has another relapse, she may not really be able to walk again. And when she came in and I went up to the hospital to see her, guess what she said to me? She said that she had stopped taking her medicine on her own because of something that she had either read or had been told. And this is super important because MS medicines are only to be discontinued when the person who's prescribed them for you tells you to, okay? So the decision to do it on your own, even if you choose to do that, you need to do that in conjunction with your neurologist, all right? You never stop your medicine for any other therapy, because there's not any magic therapy out there other than standard conventional therapies. So I just wanted to stress that for folks. So when I look at chiropractic care, I look at it as complementary. I don't look at it as an alternative. So just like when you go to physical therapy, if you need a brace on your knee, that's not alternative care. That complements the care you're getting with your other providers, okay? So you should never think of, quitting your neurologist and doing only acupuncture, quitting your neurologist and doing only a vegan diet, because that usually doesn't work out so good. Complementary therapy is a more realistic definition of treatments that complement, not replace MS treatments. So always share your thoughts and ideas regarding your therapies with, your doctors that you're treating with. So I would tell your family doctor, and I would also tell your neurologist. So my warning for MS patients, for anyone who goes to a chiropractic doctor, I'm not a fan of forceful neck manipulations. And it doesn't even matter if you have spinal cord lesions like the one that I just showed you. MS patients are very prone to a condition called Lermite sign. And what that is if I flex my head forward, if I look down at my lap really quickly, and that causes an electric shock feeling down the course of my spine or into my extremities, that is not a good sign. And so it makes common sense that you don't want to have your neck manipulated if you have Lermite sign present, because guess what it's going to do, folks? It's going to reproduce it. And it probably is not going to feel good. And then will it make your MS worse? No. If you lean back in a barber's chair to get your hair washed at the hair salon, if that happens, is that going to ruin you? No. However, this can happen when these positions of the neck are done. So I just want patients to understand that's the reason that I do not agree with having forceful manipulative therapy of the neck done. So what I usually do is I like to do very gentle, light force, stretching, non-force techniques, because a lot of times when you loosen up the soft tissue and you loosen up the muscles and you do some stretch, you get the vertebrae to move on their own. So I kind of work on the structure of what surrounds the spine, which is the muscles and the fascia. And that allows the spine to move a little bit freer after we get that taken care of. And then more importantly, have your chiropractor send their report to your neurologist, because believe it or not, many or most neurologists don't know what we do as chiropractors, and they might want to know some of the things that I just told you, that we're taking caution in not doing manipulation of the neck because we don't feel it would be beneficial for you. We're using alternative therapies like myofascial stretch or what have you. Now, the training for a doctor of chiropractic, now, this is in Florida, so I know I have some folks that may be from other states. In the state of Florida, we have to have an undergraduate degree, and then 4 years, and then our DC degree. So it's a minimum of 8 years. And then I went on to specialize in neurology, which is an additional 3 years. And if you look at the curriculum of chiropractic school to medical school, the first 2 years are almost identical. So where we vary is where obviously our training is. Medical students for their last 2 years just do clinical rotations in all the specialties, whereas in our clinical internship, we start seeing patients in our 3rd year, but we also continue to take classes in radiology, orthopedics, and specialized classes that are specific for our training. And then the thing to know is that chiropractors spend a heck of a lot more time learning manual therapy procedures, more than any other discipline who does them. So there are some physical therapists out there that are entering into training programs and residencies to where they're learning manual therapy techniques, but their training is limited. And it's one of those things where we kind of feel like our training, because we also have a little bit more advanced training in the diagnostic realm, because in the state of Florida, we're licensed as primary healthcare physicians. And then many people may know that chiropractors also, we take our own x-rays, we interpret our own x-rays, so we spend a lot of time learning the art of radiology and reading a number of different diagnostic studies. So years ago, I did a presentation like this for the Multiple Sclerosis Society, and this was before Zoom, so this was actually a teleconference. And what I had found is there was a research study that was done in the UK that was published in 2009, and it was at the McTimoney College of Chiropractic, and this was on MS patients that utilized chiropractic care in the UK. Now, chiropractic is completely out of the health system, so patients have to pay completely out of pocket. There is no coverage in the socialized health system. And what this was a survey questionnaire that was sent to patients that were 18 years or older and that were members of the MS therapy centers. So the results of the study showed that 91% of MS patients utilize complementary therapies. 52% utilize physiotherapy. So in Europe, physiotherapy is what we would know as physical therapy, only it's a lot more intense in terms of hands-on work, and it's I think a little bit of a different discipline. 44% utilize massage therapy, and then 42% utilize chiropractic. So if you look at it, there's a large percentage of patients that are paying out of pocket. And you know as well as I do that your average person in the UK doesn't have a lot of expendable income. And so if they're spending their own income on therapies, my assumption is they're helpful. Of those patients who utilize chiropractic, 68% use it to manage symptoms and would recommend it to others. Under 50% had consulted with their general practitioner prior to receiving treatment. So a lot of doctors don't even know their MS patients are going because they don't want to hear negative things about it. You know what it's like when it's your life and you're dealing with a problem and someone tells you not to go to somebody that can possibly help you? That's not really positive. So a lot of patients give up arguing with doctors that refuse to refer them because the excuse is the doctor doesn't know a lot about what we do. And I find that to be a pretty poor excuse, because I think in this day and age, it's important to understand what the other options are for patient care. And then of the GPs that did recommend it, 79% of it supported the decision. Well, what are they going to do after you've gone, right? No, don't go. Now, 78% of those GPs who did not support the use of chiropractic, they cited the lack of knowledge. Okay, so you think that's fair? Oh, there's a new MS drug out, but I'm not going to prescribe it for you because I don't know about it. How many would accept that? Not a lot of people, right? So we accept it from doctors sometimes. That's their way of saying, not only do I not know about it, but I don't really want to know about it. And this is where it's important for patients who have had a positive experience to report back to their providers and let them know that, guess what? Patients who have MS, they can go to neurologists, physical therapists, mental health providers, and chiropractors all at the same time. They can do that. It's really allowed. And not only is it allowed, but it's really the patient's choice. Okay, it's a patient's choice. We're in, a world of to where they did a news show here in Jacksonville to where people are paying $75 a visit to have acupuncture done on their dogs. Okay, so folks, do you think we're worthy or what? Of those people who participated in this, all of the MS therapy centers offered physiotherapy and massage, but none of them offered chiropractic. So can you all see why this isn't studied too well? How do you study something that's not offered? And if you do study it, who's going to fund it? So this is the entire crux that I deal with as a chiropractic doctor who's very skilled in neurology, who knows I can help people in a health system, and it's very difficult to get it implemented. So statistics about MS in the UK. Now, these are old stats because guess what? They're actually double, right? Didn't we find out that actually the amount of people that have MS has doubled? So this really is a double feature here. So the prevalence is actually going to be, it's going to be double this. There's going to be about 190,000 people to have it in the UK. And of that, at the time, 42% of patients in the UK utilized chiropractic. 25% utilize it in the US. And so of those in the UK who said that it was a limitation, it was financial, was part of it. All right, so how were patients directed in this study? Well, a majority were directed by a friend or relative. 37% were directed by the MS Society website or from an MS support group. And then only 13% had heard about it through their primary care doc. So the study conclusions were that it was well utilized, and a majority were directed by friends, family, and MS support groups. And that's why teleconferences like this are important, because this is really one of very few opportunities that I've ever had as a chiropractic doctor to address a chiropractic audience, on a national scale. And more knowledge about the efficacy of primary care doctors about MS management. So I think one thing to recommend to your docs is that there have been more recent studies done. I have one study here that is called The Pros and Cons of Chiropractic Care for MS. It was written in 2017. And it says that chiropractic care cannot directly treat MS or its symptoms, but it may be able to relieve pain and discomfort related to it. And there are a number of patients in here who give testimonials as to why they go to chiropractic. One of the things that I thought was striking was a statement in here from a nurse practitioner. And I'll just read this to you because this kind of gives you the general attitude of, and this is from an MS center too. It says, while this doctor doesn't prescribe chiropractic care for her patients, particularly those who have spinal lesions or degenerative changes in the spine, she notes that gentle massage and chiropractic care are, and this is in quotations, permissible, especially if it's making people feel better about themselves. Okay, so that statement right there in itself doesn't really demonstrate knowledge of what we do, because we do more than make patients feel better about themselves. We can actually help some conditions they have that help their mobility, that keep them in pain, that are sometimes overlooked by their other doctors, and where patients are given an increase in amount of medications, which may not be the total answer to the resolution of their problem. Okay, so there's also a very strong statement in here from a chiropractor who'd been in practice for 30 years who also has MS. And he said exactly what I said, that chiropractic care helps relieve symptoms related to MS, but it doesn't cure MS. And that he totally recommends your chiropractor sharing with your doctors your treatment plan, just like your physical therapist does. So my conclusions would be that chiropractic care is something to consider. And in chiropractic offices, we do massage, we do nutritional counseling, we do acupuncture, we do acupressure, we do laser therapy. So there's a number of things that chiropractic offices may be able to offer an MS patient. I would recommend somebody trained in neurology. Do not consider replacing standard MS treatments. And even though some physical therapy practices do not like patients to be treated with chiropractic at the same time that they're receiving physical therapy, the reasoning being they want to know which is effective. So I would respect that opinion if you had to do physical therapy first and then follow up with chiropractic care, because there does come a point where you will be released from physical therapy and given home exercises. And then my feeling is an informed patient, somebody that understands their options, has a better idea of whether maybe this option would work for you. In the state of Florida, there's been a huge push for patients to utilize non-opioid treatments. And what we're finding is that if we're using complementary therapy for our chihuahuas, we should maybe use it for ourselves. So complementary therapy is not a luxury, it's a necessity in some cases. Now, what I wanted to share with you is if we have patients that are 50 years or older and they do have chronic pain, it can be either due to MS or due to arthritis or due to both. We have a pain management study through the Department of Emergency Medicine, and I actually have about a half an hour lecture on chiropractic and spinal conditions on there. They allowed me to do a lecture here in the Department of Emergency Medicine, the Division of Research Department, Emergency Research. If you click on this link, it'll take you to what's called the Aging with Pain series. So if you're 50 years old, you can participate in these different sessions. And then if you do the surveys, I think they give you like a $10 gift card if you do these multiple surveys. So for those that are interested in participating in a research study, it'll go over all of the complementary therapies, and it talks about things like acupuncture, visualization, biofeedback, just a number of different things. Megan Weigel, who many of you may know, who's an integrative MS nurse practitioner, she is going to have some presentations on this program as well. And this program has been funded by Florida Blue Foundation. So for those of you, you don't have to live in state, I don't believe, to participate. Those of you who are interested, please use this resource. So I wanted to take this time to wrap up and say thank you to everybody, especially the MS Foundation, for just allowing me to give you a little bit of my insight about chiropractic and how it relates to patients who have MS. And, I'm lucky because I do have a number of MS patients that I continue to follow. And it really does make a difference in their life. And I think that it is something for some people to look at. It is covered by many insurances. It's covered by Medicare, but there are obviously limitations in the coverage. So if you feel like it's an option for you, I would give it a strong look. With that, I would like to say thank you, and I'm happy to open up the floor at this time if we have any questions at all.
Thank you, Dr. Chaifetz. That was
God, I did it in 58 minutes. I can't
amazing. You're getting quite good at this. Thank you. Thank you. That was fabulous. I was really interested in that. Anyway, so what I'd like to do is tell everybody that's not familiar with the program how they can post their questions or raise their hand. So if you have a question or comment, please use the raised hand feature in the app, or you can just send your question via the chat. To raise your hand, you click the screen to pull up the menu. You select more, which is that little icon with the 3 dots, and you click raise hand. I'll unmute you, then a button will appear on your screen asking you if you want me to unmute you, and you'll say yes. So we do have something while we're waiting for that to come in. Somebody actually emailed us by the name of Ruth, and she asked,
Bruce.
Yep, she said, can chiropractic help with my migraines?
Yeah. Now, my question would be, Bruce, are you having Botox done? Or have you gotten to the point where your migraines are to that level? And if you're getting Botox, what that tells me is that the muscles in the neck are playing a role in your migraine headaches. So I have treated patients that are also getting Botox. And what we usually see with patients with migraines is if they're on Botox, that's like the highest level. So you probably would have to try and fail several medicines before you would get to that level. But in short, the question is, if you have neck components and you feel neck tightness when you get your migraines, I do feel that chiropractic and/or massage, soft tissue release type therapy would be very beneficial for you.
Great, thank you. Dr. Chaifetz, do you find in where you are in Jacksonville with UF, do you find because they're familiar with you as a neurologist that specializes in, as a doctor of chiropractics who specializes in neurology, do you think you have taught them to be more sensitive to this and to be more accommodating for people that want to go through your process? Like, would you, they're more easily, willing to recommend people to go to chiropractic because they know what you do, as opposed to a center who doesn't have a clue what chiropractic does for MS?
Yeah, and we're lucky because, so I think what's important to understand is that people get to know me as a person before they know me as a chiropractor in our program. So the MS patient who's just choosing a chiropractor, they don't know the person. So I treat many healthcare providers, nurses, nurse practitioners, even neurologists. I've had several as patients. So I think they are open to it to the degree that they're not going to tell patients not to do it. Like they're not going to say, oh, if you go, won't treat you, stuff like things we used to hear back in the 60s and 70s. There were some real issues between organized medicine and chiropractic. And the medical profession literally went through a legal suit to where um, they had to kind of stop some of the tactics that they were using to discourage patients from going to chiropractic. Because when you think about it, chiropractic students are like medical students. We go to school for a long time. We have hundreds of thousands of dollars in student loans, but we don't get to do paid internships and paid residencies. The burden of our student loan debt is on our shoulders 9 months after we graduate from school. So that's why most chiropractic doctors work for themselves, because there are not opportunities in other establishments like biggest hospital groups. And so it's frustrating to me because I really feel like every rehab department should have several. I mean, if every professional sports team has several, I think it's very beneficial. But the bottom line is always insurance coverage. And just like we think of massage therapy as a luxury, it honestly is not on the level of necessity the way that it should be. I mean, I would love to see a patient get any therapy they like under any circumstances, to where patients have licenses and are licensed to practice. No one should be able to dictate to a patient what they should or shouldn't have unless it's definitely an adverse treatment to their health. And I would say that many of us are educated to know, what our limits are.
I can tell you that when my husband goes to his favorite chiropractor and my husband goes to his favorite, my son goes to his favorite massage therapist for deep tissue, and my husband goes to his favorite chiropractor, they literally leave the office and for the next day are in a state of euphoria. Like they are just in the best moods and they feel the best out of the entire month. So they absolutely love it. But we do have one from Casey, a question, who says, with spasticity, does chiropractic help stop it from happening or just relieve the pain?
No, because see, the best way that I can the best way that I can explain spasticity is just the constant bombardment of signals to the muscle, which keeps it just locked tight. So in cases where the patient has spasticity, what I find is that passive stretching really works so much better. So when you say, does chiropractic help? Yeah, if you come to my office and I passively stretch your spastic muscles. But if you go to somebody who uses a technique where they only manipulate the spine or only adjust one vertebra in the neck, then that might not have a dramatic effect at all on their spasticity.
Okay.
All
So
right.
how do
Like,
they choose? How do you know who to go to?
well, okay. So the first thing you want to do is in your area, you want to see if there's a chiropractic neurologist. If there is, see if you can go in and consult with the doctor for just a consultation. And through your discussion with the doctor, and you MS folks are some of the smartest people I've ever dealt with. So you'll throw them for a loop when you start asking questions. And you'll know in a few minutes whether I think you're in the right place or not. If they can't answer your questions quickly and honestly, and they're not sure if they can help you, then maybe that's not the right place to be. Don't be surprised. Ask your physical therapists and your GPs who they recommend, because they hear names of doctors because many patients who go to PT go to chiropractic too.
Wonderful, thank you. By the way, everyone, if you wanted to write down, for anybody that's not looking at the chat, the link that takes you to that, not survey, the
link.
Yes, no, the link that it's not a survey, but it's the
study.
Thank you, Casey. To the study. It's there if you want to jot it down before the end. It's www.tinyurl.com/aging with pain. If you'd like to participate in that study, that's
yeah, and actually I'm in the study because I'm over 50 and I have neck pain. And so I participate both as a patient and a provider. And every time you listen to a lecture, they send you a survey and then they send you a $10 gift card. So, it's worth giving your input while maybe treating yourself to lunch at the same time.
Oh, nice.
Yeah. Nothing at all wrong with that.
I don't think we have any more questions. I will wait 1 second. Let me just check to see if anybody's raising their hand. And I don't see that. So
I just want to thank Mike, who's online here. Mike is one of my buddies. He is my model in my manual. He is my model in my presentation. And he is one heck of a decent guy. And I just want to say thanks, Mike, for listening in.
Thank you, doctor. Thank you.
That was nice. Okay. Thanks, Mike, whoever you are, Michael Burrow. So that's all we have for now. If you've missed any part of this conference, it will be replayed on msfocusradio.org within a week or two, and available on demand or on our MS Focus SoundCloud page or our YouTube page. Actually, the YouTube page is probably going to go up a little quicker than the SoundCloud and the radio. So remember to follow MS Focus on Facebook, Twitter, and Instagram for times and access information. Our next teleconference is going to be this coming Tuesday, May 11th at 3:30 p.m. Eastern Time with Dr. Ben Thrower. He'll be talking about managing MS fatigue. Our sincere thanks to all of our attendees for your participation, and especially to Dr. Chaifetz, who was kind enough to share this information with us today. Thank you, everyone, and have a great day.
Thank you.